Why are you closing hospitals? Why are you putting A&E into one town?
Are these changes just to cut costs?
Haven't you already made your minds up?
We're not closing either of our hospitals. We're developing new facilities which will be modern and fit for purpose and deliver better standards of care for the future.
It's actually a very significant investment in local services, so it's certainly not a cheap option. It's actually addressing some long overdue modernisation changes that are needed.
By having planned care all in one place and the emergency care in one place, you can have all your specialist resources on that site to become a centre of excellence, really.
When we look at the staff that we're trying to attract, but also keep here in Calderdale and Huddersfield, this will move us towards having a specialist centre that will attract more doctors, more nurses and more therapists who will want to come and work in this hospital.
The benefits for having planned care on one site are that we've got our nursing staff and our support staff that are trained in delivering care along every bit of that pathways, from the pre-operative side to the recovery side and the post-operative care.
So these are patients who are having surgery or other procedures which are planned some time in advance. They can be confident that the procedure will take place at the time we plan.
We sometimes have to cancel some of our elective procedures now because we have emergency cases coming into either theatre, or we might have some medical patients that need to use some of our beds on our surgical wards. Certainly from the planned care and the surgical perspective, there'll be 10 brand new theatres that we'll be able to utilise to deliver the best care for our patients.
We're not closing one hospital, we're not closing one department. What we're doing is we're making one purpose-built emergency centre. The reason that I feel it's the right thing to move both emergency departments into one is because it provides the best quality and safety of care.
If you're critically ill, we will have the right doctors there available to make quick decisions to provide the right care for you.
So there are acute specialties, things like surgeons, medical experts, intensive care doctors, who all need to be available just in case their expertise is needed.
By putting services together into one hospital, we can ensure that we do meet national standards, and therefore the population of both Huddersfield and Calderdale will have the best care available 24 hours a day, 7 days a week.
It will deliver better outcomes for our patients as well. So, fewer deaths happening because our care is better.
It allows us to have one strong, solid, safe, effective service for the people of Huddersfield and Calderdale for years into the future.
But I think it's also a really exciting opportunity because we could have an emergency centre specifically for children. So this is not just going to be a part of the hospital where children are kind of tagged along. This will be a specialist unit for children and young people, staffed by specialists, both doctors, nurses, therapists in paediatrics who can be there on hand in an emergency, and in an environment that's suitable for children as well.
The most important time when you're very ill is the time for the ambulance to arrive at you. They very rarely set off immediately with a seriously ill patient. They will spend some time at the scene stabilising and initiating treatment. So an extra time spent in an ambulance when you've already been stabilised is much less hazardous than being taken to the wrong place.
We will have urgent care centres on both of the main hospital sites, so probably more than 50% of patients who currently attend accident and emergency centre will still be seen in their local urgent care centre.
And I think it's really important that people realise that actually both children and adults sometimes have to go beyond where their nearest hospital is, not because that hospital won't be able to look after them, but actually the specialists that they need aren't always at their closest hospital.
As people are living longer and as people have multiple long-term conditions, they're not well served by a hospital-based model. So a very important part of this vision is to actually reduce the dependence on hospitals, to enhance the quality of care closer to where people live, and maintain people independently living in the community where we're absolutely sure they would prefer to be. That is something which we call care closer to home, and it is already avoiding unnecessary admissions to hospital and maintaining people's independence.
This is not about saving money. However, we can't deny that times have got harder from a financial point of view, and as we are going to, in effect, have to borrow money to invest in our hospitals, we have to do this in the most cost-effective way. We're really pleased to be out in public consultation now. This is our chance to talk to the public about the proposals and also listen to their concerns and try to address those. We are really keen that the public in Calderdale and Huddersfield get their chance to have their say. So we're encouraging them to fill in our survey. They will be able to find these online at the Right Care, Right Time, Right Place website, but also in their local GP, in community centres, in the hospital, and also on the Greater Huddersfield and Calderdale CCG websites.